Let's now talk about wounds, and this is part 15 of emergencies in first aid. A wound is a break in the continuity of the skin or mucous membrane, or just an injury to soft tissue. Wounds can cause bleeding and infection. So, when you are performing first aid, your aim is to control bleeding and to prevent infections. There are different types of wounds, and they include abrasion. Abrasion is basically scraping off the skin. So bleeding is going to be limited when there's an abrasion. There's also an incision, which is a cut with a sharp object like a knife, scissors, razor blade. If the cut is very deep, bleeding is going to be very heavy and it can damage muscles and nerves. You also have laceration. Laceration is tearing of tissue from excessive force from blunt object. So for here, bleeding is going to be very much heavy. Okay. Deep lacerations may become infected. You can also have a puncture. A puncture is caused by sharp objects like a pin, a nail. You can have a bullet, spear. It can be deep or narrow. It can be dangerous because of damage to internal organs. External bleeding can be minimal, may lead to infection. So a puncture, mostly you'll not be able to see bleeding outside, but then it can lead to infections in the inside. You also have avulsion. Avulsion is basically tissue torn or separated from the body. So bleeding is very much heavy, important to preserve the body part when there is an avulsion. Okay, so that for sometimes that body part that has been torn off can actually be retouched by a surgeon. There's also a contusion. This is just a bruised skin. Okay, and the skin is not torn, but hematoma is produced. So we're going to be seeing a collection of blood under the skin, and usually that is going to be caused by blunt objects. There's also amputation. Amputation is where a body part is separated or cut off. So bleeding is going to be very much excessive, and it is important to preserve the separated body parts in case of reattachment where there is an amputation. So we are going to wrap the part of the body in a cool, moist dressing and place in a plastic bag. Okay. Make sure that where you are placing there is also sterile water or saline, which is more preferred. You keep the bag cool or in ice water and transport with the victim in case maybe there was an accident and then the leg was cut off. So that is what you do, and then you transport together with the victim. Don't place the body part in a direct contact with the ice. Okay. So this is what we're talking about, an abrasion. This is an abrasion, basically a scrap on top. You have got an incision, which is a bit of a deep cut with a sharp object. And then you have got a laceration, and we said laceration is just a tearing of tissue due to a forced blunt. Okay, there is just whatsoever that happened. Imagine maybe there was just a forced cut like that. Imagine maybe you are jumping or something, and then the tissue was torn, more like it just broke like that. Okay, and then you also have a puncture. A puncture is where there is a deep, you have got something sharp entering your skin, for example a bullet, a needle, or something like that. Avulsion there. Avulsion is the tearing of tissue, and the tissue can be separated from the body. So here you can see there can be a tissue that was moved out of this place. So you keep that tissue so that you can replace it in case it is possible. And then you also have a contusion. Contusion, on the other hand, is just bruised skin, and we are just going to see hematoma. You not see really blood coming out, but you see a collection of blood under the skin. And then this is amputation, where there is a cut of a body part. How do you manage wounds? The first priority in managing wounds is to control bleeding. Then you want to reduce the risk of infection. So the practical steps that you do is you stop bleeding, sit or lie the patient down, expose the wound by removing clothing, apply temporal dressing and avoid unnecessary exposure to air. Okay, you will get to dress the wound temporarily. You are going to wash your hands with soap and water. You remove any foreign bodies with bandage. You are going to then clean around the wound with antiseptic except in penetrating wounds of joints and cavities. And then you are going to apply a clean, sterile, fresh dressing and firm bandage. And then you transport the victim to a nearest health facility. You can also have abdominal wounds. For in case of abdominal wounds, what you want to do is you relax parts around the wound by rolling a blanket or any clothing and put it under the knee. Okay, if there's anything, if there was any clothes, make sure that you roll them off so that you relax the part. Do not attempt to retain any protruding organ like the intestines. In case the intestines have come out, don't attempt to take them back. Cover with a sterile dressing or clean sheet and fix bandage lightly around it. You don't want to make it tight, just do it lightly because you might worsen the situation. And then make sure that you transport the victim to the nearest health facility as quickly as you can. So that is going to be it for this part. In the next part, we talk about bleeding and how you can